what would be the initial response is reflexive, and that's at the spinal cord level. That's actually not a motor response from the brain. You don't even know a reflex happens. Is that what you're talking about? So that motor response actually occurs at the spinal cord level. We'll talk about that later. But you're not even aware, you've already pulled your hand away before your brain even knows about it. So that all happens as a reflex activity.
Did we go over reflexes?
We have not. We're going to go over that the next go round. Okay? You're working with a patient that's having trouble maintaining consciousness during treatment. Which part of the brain stem reticular formation is damaged, and that's midbrain. Remember that your consciousness is at the midbrain level, and that your basic life functions is at the medulla. You're working with a left CVA patient who sits tilted in the chair to the right. When you sit them up on the mat, they have good trunk strength, but remain in the tilted position to the right. You ask them if they are upright and straight. They say yes. Which lobe of the brain is damaged? And that's the parietal lobe, where that body image is, and just a lot of your sensory stuff, perception. You're working with a female TBI patient, and the orders from the acute care hospital tell you that she has to be monitored closely because of an intense sexual drive. Which area of the brain is probably damaged, and that would be hypothalamus. Remember, that's your desires and all kinds of issues. This really does happen, by the way, with female head injuries. And it's a very, if you ever have a female child that has a head injury, you need to really monitor this. Because there are men in the hospital who might take advantage of them, and this has happened in my knowledge before. Because they lose their inhibition, and what happens, if a man loses his inhibition with a head injury, they just start pawing at women, and that turns women off. But if a woman starts coming on to a guy, what happens there? So you have someone that would take advantage of someone.
What are you trying to say, Jerry?
The truth.
I have a question.
If you have a guy, though, who has no moral, they'll just, take advantage of his little head injury.
Could this affect,
A woman of any age, quite frankly.
could this affect a woman like if they have it after a stroke?
It can, yes.
Because when I
Any type of
observed,
brain damage.
when I observed there was an elderly woman had a stroke, and they had to keep a blanket on her.
Because she just revealed, yeah.
Yeah, well, she would pleasure herself.
Yeah, that would be, what happens, especially in the frontal lobe too, is you lose inhibition. That's part of your personality area. And so if you lose those inhibitions, then that can be a real problem of all kinds. They become safety issues, but it's more of a problem with females, Josh, than just males. That's been my experience.
That's why, like, my nanny got dementia real bad, and she
volunteered to monitor.
terrible, and she would die if she knew.
If she knew.
She acted that way.
Yeah, you just have to kind of protect those
Different kind of
patients.
stroke.
You're working with the right CVA patient, and you realize the patient is paralyzed on the left side. You first thought, because of neuroanatomy and pathology class, is that the motor fibers cross over to the other side of the body at the medulla oblongata. That's where they do that. The pyramids in the medulla oblongata are motor fibers. Okay. You're working with a TBI patient who used to be a pastor in the Baptist church. The family states he's completely different and is now argumentative, rude, and cusses every other word. I had this patient too, by the way. And the damage to the brain occurred in the frontal lobe, because that's where, again, that inhibition is affected.
What happened to him?
He was in a car wreck and he hit the front.
That'd have to be hard on the family.
She was so determined to take care of him, but he was not the same man at all. Had nothing, and he did not improve.
He didn't.
No,
Oh.
very severe head injuries. It's just so nice now because head injuries do so well. Because of that trauma care, it's head injuries are really hard to deal with.
Born in there.
How would you evaluate a patient for a stereognosis? And that would be putting a coin in the hand. That's how we do it usually. Lesions of the primary motor area of the cerebral cortex of a patient may cause contralateral paralysis. Remember that crosses over, so it would be the other side. Your body has a sympathetic ganglionic chain, and it's right next to the spinal cord. The thalamus is the major perception area for which sensory modalities, and that's pain and temperature. Which of the following would be considered a function of the cerebral cortex, and that would be sensory integration. Remember that respiration and heart rate are at the medulla oblongata, and your hormone regulation would be hypothalamus. So your cerebral cortex would be all those integration areas. What aspect of the brain stem do the sensory fibers ascend, and that's lateral aspect? What is the function of the cerebral aqueduct in the brain stem? And it's just to connect the third and fourth ventricles.
Connect what?
The third and fourth ventricles. You're working with the right hemi who needs to be able to sit up from the lying position. If you miss this one, I'm going to give it to you. You know what I'm going to do is throw this question out, but if you got it right, I'll give you 2 points. Pardon? This is, and I'll look at all of them and give you the points. Don't do anything with it. But this is the one where if they're a right hemi, you turn them up. We talked about it in class yesterday in the lab, that y'all assured me that you'd never heard before. So, since most of y'all haven't, then I believe you.
But I think a lot of us.
I was just thinking you wouldn't be able to push yourself up enough with your opposite arm to get,
Unless you had help.
You know what though, when you actually see them and work with them, it's, if you can get them completely rolled, it's the only way they can get up. They cannot get up on the strong side unless they're pretty far down. If they're real, what happens is they're so weak in their trunk because that side of their trunk is paralyzed that they're not strong enough to do it. They can't lift themselves up enough to get on their elbow, is what happens. But no, if you hadn't heard me say it, then you wouldn't have known that. But if you got it right, I'll give you 2 points, but I'm gonna just throw that one out also. I try to be fair. I thought we covered it intro, and I probably did the year before. I've been teaching too long, I guess, should I? Maybe I should go back and just practice. The red nucleus is found in the mesencephalon of the brain. What is its function? It's a motor nuclei that receives info from the cerebellum, and it goes to the basal ganglia and the spinal cord. It's kind of a neat little motor nuclei there. Cerebral spinal fluid is formed in the choroids in the lateral ventricles of the brain. You're working with a patient with a cerebellar stroke. He is reaching past the object that he is reaching for with his hand. What is his problem? And that's dysmetria, where they overreach or underreach. And then 34 is the next one I threw out. And what it is, I put an 11 instead of 9. Well, there wasn't a correct answer there. But if you put it correctly, I'm not going to give you more credit on that. That one we'll just throw out.
See how smart I was? I saw right past that ruse there.
That,
I should get points for that.
and saw right past that mistake.
I go, that gotta be a number.
Broca's area is located in the frontal lobe of the brain. Its function is expressive speech. Wernicke's area is located in the temporal lobe of the brain. Its function is receptive speech. You have a head injury patient that is unable to hear. After testing of his ears, you find out that his ears are normal. Which lobe of the brain is probably damaged? And that would be temporal lobe. You're working with a patient with a brachial plexus injury. The triceps muscle is affected. Which type of injury is this? That'd be lower motor neuron.
It's a muscle.
Which of the following would be considered a function of the hypothalamus? And that's temperature regulation. Where would blood pressure regulation? There's so many blood pressure things, but mainly the medulla, if we were just thinking about it.
Doesn't it have?
Oh, also, that's true. I'm gonna give you credit if you put blood pressure regulation also on that one. Temperature regulation and blood pressure are correct. Because the hypothalamus does control the blood pressure, pre-sympathetic and parasympathetic. So I'll give credit for both of those, so I'll check that. You missed it. Efferent means away from the brain and spinal cord. You have a child who suffered a head injury in the car wreck who also has a radial nerve injury to the left arm. The radial nerve injury is considered a lower motor neuron injury. PTA observes the gait of a 6-year-old boy. The PTA notes that the child is unsteady and uses a wide base of support. Cannot maintain standing position with his feet together for more than 3 seconds. The area of the brain probably affected is the cerebellum. You're You're working with a TBI patient with left hemispheric damage to his brain. The speech therapist tells you that he is unable to understand what you're saying to him. You hear words come out of his mouth, but they do not make sense. It sounds like gibberish. Which lobe of the brain is probably affected? And that would be the Wernicke's area, your temporal lobe.
Could you, bring in both areas on that, though, since gibberish is coming out, it's unintelligible words?
No, actually, it wouldn't be frontal lobe. It would, because that's what you see with it. It's because they're not hearing what they're saying. So it actually is the temporal lobe on that one.
How would it not, like,
They're not,
if they're not able to speak it correctly, like how would that be?
what these patients do is they'll actually, a sentence will come out, but it won't make a bit of sense to you. It's just gibberish, or they'll be talking, baby talk, blah, 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 and then a whole sentence will come out.
And they think,
And
and
they
to
think
them,
that-
they're
right.
going, why don't you understand?
Right.
My wife does that.
Yeah,
And she, you know, I gotta constantly go, what? And then finally, I've listened to her long enough, you know, I can pick up on what she's trying to tell me. But man, sometimes it's like,
yeah,
come on, get the word out.
yeah.
But she totally looks at me like, why don't you understand what I'm saying?
Yeah, they think they're saying the right thing.
I know.
But, see, they're not monitoring what's coming out of their own mouth. They're not monitoring that, which would be the temporal lobe, because that's that language where they put that in. PDA reviews a medical chart for pain medication to determine when the patient was last medicated. Time charted is 2,100 hours. It is now 10 o'clock. How many hours has it been since the patient's last pain pills? 13. Everybody get that one?
I did.
Yeah, you know what, that's, yeah, too many digital clocks in the world nowadays.
I had cousins who tell time on a watch.
Probably need to spend some time on that, because that really is how medication is charted. You have a patient who has C5 spinal cord injury, she has spasticity in her legs. Is this an upper motor neuron injury? That would be upper motor neuron because of the spasticity. You're working with a CVA patient that cries every time you work with him. It makes you very sad, and you think he must be very depressed. The psychologist on staff reminds you that it's not depression, but damage to an area of the brain. Which lobe is probably affected? It's temporal lobe because that's emotions, but it would be frontal if that was a choice for you, but it wasn't. So either one of those would be correct. The temporal lobe is correct on this one. You're coming in class to take a neuro exam. You really have to go to the bathroom. As you walk into the classroom, you find out that you're going to have to take the exam on the computer, and this makes you nervous. Which autonomic nervous system is kicking in? Sympathetic. You no longer have to go to the bathroom. You're working with a left CDA patient with right hemiplegia, alexia, and agraphia. You will see the following symptoms. And that's right upper and lower extremity paralysis and abnormal tone and unable to read and unable to write. Neurosurgeon informs you that a patient in rehab for a CVA has significant perceptual defects or deficits. Which area of the brain was most likely affected? And that would be parietal, because that would be your perception of space and your body and all kinds of things. That's a sensory term, perceptual. You have a patient with involuntary oscillating movements of the eye, and that's nystagmus. Okay?
Okay.
And I'll correct your grades and put them in here actually for you, so you'll.
Yeah, now I got a D, but on that test.
But you're actually gonna take them out, or you're just gonna push point?
I'm gonna add some of those points in and look at each one individually, so you're asking me on those two. Okay.
I thought there was three.
Was there 3 of them?
Yeah.
Okay, since y'all are already grouped up in groups of 2, Chris, why don't you come up here and be in this group? We're going to do Jeopardy today.
I'm sorry.
You got the brain on my side.
anybody said it's credit for it. We have a
You know what,
testing
I
that-
forgot candy and I thought about that.
Candy.
Yes, I usually do. He had me in medical term and I always bring candy, so I'll get y'all some.
You didn't have no candy in our medical term.
I
Mine either,
didn't
I
get.
get yours.
not mine.
How come I never got no candy?
You
I
did
got
mine.
the snack on
Were you in my
the-
class?
Mine was on-
Oh, you did, didn't you? I did.
She did.
Remember you, Blake.
I just did so bad.
You just didn't come that often.
I didn't get candy.
I was there, I just did bad in there.
I had mine online, I didn't get no candy. So that-
Couldn't send it
Well,
an email.
that online stuff's a little harder, so.
I liked it. What's the bad? All the time in the world to do all my stuff. You get to look at that stuff?
No. But it's not time to go yet.
Not at the point.
I'm just saying, you go.
Yeah.
Go and get a store, get a store,
Oh, thank you.
Jerry,
Yes.
on these here two, along with the nurse, we're gonna get out, take out his shit covers, and we'll get about an hour to make sure we're out.
Okay. Pardon?
That's what it is last night.
Yeah.
You put a little circle on it, lick it off.
Okay, we will start with your group. What would you like? But you have a lot of choices here. Cranial nerves, 1, 2, 3, and 4, and review. One.
Let's stay away from that.
What is the primary function of cranial nerve 2?
Cranial nerve two?
Mm-hmm.
One, I thought it was all about cranial nerve one.
No, it's not.
Okay. Vision.
Very good.
Ooh.
Okay, what would y'all like? Y'all need to be keeping score, by the way.
How do we?
You just put down 100. If you miss it, you take away 100 and make sure you put your names on it. The two names. Okay,
Can you keep track of everybody's or just our own?
just your two.
Okay.
Just the two of you. What is cranial nerve 3? Oculomotor. Very good. What would y'all like?
Cranial nerve one.
What is the cranial nerve that handles the muscles of mastication? Motor function, muscles of mastication.
Facial? No,
Okay, what, back there?
Trigeminal.
yeah.
Trigeminal.
Yeah, trigeminal.
Right.
Okay, y'all get one more. What would you like?
Review. Cause they're all reviewed, it sounds like. Unless review's like harder or something, we didn't know about it.
What is the blood supply of the occipital lobe?
Oh, it was, posterior cerebral artery.
Very good. Okay,
Nice.
what would y'all like back there?
We'll do cranial nerve three.
Give me 2 cranial nerves that are located on the pons. There are actually 4, but give me 2 of them.
Abducens and facial.
Very good. The other 2 are the trigeminal and vestibulocochlear, which is 6, I'm sorry,
5, 6, 7, 8.
5, 6, 7, 8.
Who do we appreciate?
Okay. You guys up here.
I take a lot of flack right now. Crippled this week.
You bet.
the eye is positioned laterally in the socket, what nerve has been damaged?
Oh, laterally?
Laterally.
Go ahead. Oculomotor.
Oculomotor, very good. Okay, next group. What would you
Boy,
like?
two.
Which number is the facial nerve? Cranial nerve number what?
Seven.
Very good.
Review for 100, please, Alex.
Sorry about your partner there.
What is the major sensory relay station?
What is the thalamus?
Very good.
I knew that.
Question. Okay, guys, what would you
I
like?
knew that.
Did you?
I did.
Because you go, oh, man.
That thing's about it.
Oh, really? You want to ding your computer a couple more times? Keep throwing rocks, class out.
If the eye is positioned medially in the eye socket, what nerve has been damaged? Abducens. Good. What would you like?
Very good.
Y'all are doing well. Y'all even looked at this and.
Sure, seeing it too.
What nerve, does the sensation of the face?
This is sensation in the face. What, little?
Trigeminal, correct. Okay? Give me two functions of the facial nerve. There are a number of them, but give me two functions of the facial nerve. Just don't come until you pick the harder one up. I'm sorry, y'all know back there?
Facial expression and sensory of the tongue.
Okay, good.
Is that 2/3 of the time, or?
That would be taste, which is talking about sensation.
So if they're the only ones that can get the ones that somebody misses,
Well, I usually do it that way.
Wow, I'll see how you do now. You'll be wanting to trade seats with me next week.
No, because they're gonna be, okay.
Review probably later.
So he gets extra because of that.
Oh, my
What's up
Lord.
with that?
Why don't you just whine about it, man? Let me get you some cheese and crackers.
What happens with muscle tone with an upper motor neuron lesion?
Oh, Casper. That easy nonsense.
You have spasticity,
Okay, so is that an increased or decreased?
that is increasing.
Increase, okay.
Video.
Which lobe is normally affected if you have a change in personality and speech?
Frontal.
Frontal, very good. Which one up here?
number two, I did it.
What, nerve controls the muscles of the tongue?
Cranial nerve?
Mhm.
Oh. Is it hypoglossal?
Hypoglossal.
Oh, okay, well, good job. So I didn't know.
CN3.
It was either 9 or 12.
Yeah. That was my first test.
of of taste on the tongue. Anterior 2/3 of taste.
Okay. Trimenium number 5.
Incorrect. You guys know back there?
Facial. Oh, sorry.
I didn't bring this. Anterior 2/3 of the taste
Oh, that's right.
on the tongue. You guys don't know? You guys know back there? Facial. Facial. Okay, you get another one.
Go
Oh,
with
which one?
review for 103,000.
Which one?
Review.
Trust me, I'm not anywhere near as smart as Alex is, nor as organized.
He has a computer producing all this stuff.
Oh, you think you know how old that man is? He's like 88 or something. He's in his 80s, yeah.
That's like 5
Still making the money.
Yeah.
It's all that brain activity that keeps you alive.
They've been around a long time.
But it does.
She's had a little plastic surgery.
That'd be a millionaire.
He knows what he's doing.
Tell me the 3 major divisions of the brain.
Original Paris Hilton.
3 major divisions of the brain. Don't make it hard. It's easy. We didn't put a lot of emphasis on it. but
Talking
I-
about like right and left hemisphere.
Too hard.
Too much division. What are the 3 divisions? What are the 3 parts of the brain when you look at it?
Oh.
So he just a test of wands.
There's so many parts, I don't really know.
I think it was like,
Yeah.
It's this side, this side, this side.
No, I'll throw that one out, but it's the cerebrum, the cerebellum, and the brainstem. We shouldn't talk about that so much. Okay, I'm gonna give you another one. What which area of the brain controls the vital bodily functions?
that would be the brainstem. You
Yeah.
want more specific?
I
Like
want
the
more
medulla?
specific. Medulla, very good, thank you. I was gonna ask you both of those. Okay, what do you
I have
have?
a question.
Yes, ma'am.
What's that thing called, the
Reticular formation, it's right in the very middle of it.
okay, so, all right. C3.
What are the 2 cranial nerves that have to do with the gag reflex?
Is it glossopharyngeal
So no?
hypoglossal?
No? You guys know?
So I guess through Vegas.
Vagus, yes, glossopharyngeal and vagus, it's 9 and 10. Okay, I'll get another one, what would you like?
Let's just go ahead and see what Singapore is gonna be like.
I don't think they're hard, well, they are a little bit, some of them are. If you have glossopharyngeal neuralgia, what symptoms do you experience? Glossopharyngeal neuralgia.
This first semester, initiating our.
It sounded good, didn't it?
Back there in the back,
That sounded good.
it did sound good, that was incredible. I talked about it for about 2 minutes.
There's a whole lot of other stuff that we have to
Well,
get
y'all were
into.
really thinking about other things.
If we did it for three, we'd have.
When they get your turn.
You know what happened if you locked your in the basement?
Inability
You'd have
to
a
swallow.
wine cellar.
Incorrect. I'm going to Kenneth because he knows, you know. Glossophryngea neuralgia. What is it?
Make
Now,
an open
what
question.
symptom do you see with glossopharyngeal neuralgia? What's the major symptoms?
Probably like my wife is saying the wrong thing.
That's a good guess. What is it, Kenneth, since you know?
The throat hurts, get pain in the throat.
Yeah, real severe sharp pain in the back of the throat. Okay, I've got to go. So we're gonna do this again on Thursday. Bill is going to give you a paper test because I had trouble getting it on to the computer. So you may take it now or you can wait till 9:30. What would you like to do? You wanna go ahead and do it now? Everybody knows for that? On the computer.
What?
So you wanna take it about 5
Well,
minutes?
the only thing is, I'm looking for a calculator, I didn't have another calculator at home, since you don't.
I have one. I'll give you, let you borrow one. I don't mind y'all trading around calculators, but I do have one in my office.
Yeah, I don't have one either. Can I just use one?
I don't care if you have your computers out, that's fine.
Yeah, there's one.
Just don't go to PowerPoint.
Alright, man, I'll see you next
Oh,
week.
well, yeah.
Yeah, at least on one thing.
I don't like when we get a long ball in this.
Yeah.
What is it? Yeah, hand those in to me so I can give you credit. Yeah. Or y'all keep them for next time, just keep them and we'll just keep adding to it. I'll just don't put it, I don't have to do it twice. So keep them so you'll have them. Okay.
It's
You
a
need-
brick tape,
Okay.
Josh.
I think you bring a pencil, that's what we're gonna do, a computer test.
Oh, really? You never done this before?
You may have a pencil. I'm so used to computer
Did it
tests.
go into, 10%? Yeah. She doesn't learn anything, she tries to help you learn.
26 to 125.
She did medical terminology a ton.
Better than I was gonna go up there. Sure, I didn't even look at.
Well, she asked questions that I didn't think, you know, she asked questions that was like from the previous deal. Oh, I didn't know, I didn't have a clue.